In this film, we show you how to inject Caverject. The Caverject Dual chamber syringe consists of outer protective cap, inner protective cap, superfine needle, clear plastic tip with glass cartridge inside, dose window, and plunger rod. Preparing the syringe. Wash your hands and dry them with a clean towel. If your partner wishes to help you prepare or give the injection, they will need to wash their hands too. Take the disposable syringe and the needle out of the box and peel the foil cover from the needle. Attach the needle by pushing it firmly onto the tip of the syringe. Turn it clockwise until it is firmly in place. There are two protective caps on the needle. Remove the outer protective cap of the needle. Hold the syringe with the needle pointing upwards. Make sure the plunger rod is in the extended position. Turn the plunger rod clockwise until it stops. The powder will now mix with the diluent. Turn the syringe up and down a few times to mix the solution completely. Do not use the solution if it is cloudy or contains particles. Hold the syringe with the needle pointing upwards. Carefully remove the interior protective cap from the needle. Make sure that the needle is not bent. If the needle is bent, you must not use it. Flick the cartridge once or twice to remove any large bubbles from the solution. Hold the syringe with the needle pointing upwards and turn the plunger rod to the right to check that it is in its stop position. Then press the plunger rod as far as it will go. A few drops will appear at the needle point. Slowly turn the plunger clockwise to select your dose. There are 4 dosage options. Each option is one of 4 quarterly parts of the full dose delivered by the syringe. Your doctor will have told you which dose to choose. The number appearing in the window indicates the dose selected. If you make a mistake, simply keep turning the plunger rod clockwise until you reach the correct dose. You can prepare the injection up to 24 hours before you plan to use it, providing you keep the solution at room temperature. How to perform the injection. Take off your clothes and make yourself comfortable. Take time to relax, both you and your partner. If your doctor has recommended that you use a sterile swab, now is the time to do so. Make absolutely sure that the needle is not bent. If it is bent, you must not use it. Throw it away. Do not try to straighten it. Injection points. Hold your penis from the front with your forefinger and middle finger on the underside, close to the scrotum, and your thumb on top. Gently squeeze your penis to make the injection point bulge out. If there is foreskin on the penis, make sure to stretch it out. The injection will go in the part of the penis shown here. Do not inject in these places. Clean the injection area with the sterile swab and let it dry. Check the dose indicator and, if necessary, adjust it until the correct dose is displayed. Hold your penis firmly in one hand, hold the syringe in the other, and insert the needle into the bulging area at an angle of 90 degrees. Make sure to avoid veins and other visible blood vessels. Make sure that the syringe is at the correct angle and firmly press the plunger rod. If you have problems injecting the solution, move the needle slightly and try again. You should not have to use a lot of force to inject the solution. Pull the needle out. Press the sterile swab gently against the injection point. Massage your penis to help spread the solution. If there is any solution left in the ampoule, do not save it for later use. Throw the syringe after use as instructed by your doctor, so no one can get hold of it or scratch themselves on it. Remember, you can prepare your dose of Caverject Dual up to 24 hours before use. Do not reuse any liquid left in the disposable syringe. Choose a different injection point every time you inject yourself.